Crusty Gnome, it's political now because there's a large contingent of Americans who will never trust medical experts again. I would argue that the reason why that's the case in the first place is because of politics. But do people forget this? But in the early days, like in the early days, like in the third week of March, you had right-wingers going around with a microphone like, I don't see any bodies here.
Yeah. Dave Rubin.
Was he in New York or in Florida?
In L.A. He's walking around L.A. I think it was L.A. saying, because they can.
There were people who were later, like going down to the the refrigerator trucks in New York City and going like, I don't think there's anybody in there. And then, do people not remember like the whole pandemic thing? Then the question, like, it's fake, it's not happening. Then it's actually manufactured, and it's just the way, like, without a doubt, there were failures. I would argue the vast majority of these failures were a function of not enough resources wanting to be expended to make places safe. Like federal government, remember, like Trump spent the first 4 months in total denial. Instead of saying like, we're going to marshal billions of dollars over the course of the summer, we're going to go into schools. We're going to put in air filters. We're going to deploy resources to figure out the safest way to get kids back into school, the safest way for teachers and staff at these schools to be back into school. They didn't do any of that. Instead, you had over the course of the spring, states competing for PPE. Do people remember this? You had states stealing stuff from other states because it was sort of like a Hunger Games situation.
On this note of trust in medicine, Abdul El-Sayed was on with Ayman this weekend on MSNBC, and this was a really good answer about this CDC stuff and sort of what needs to be built up in the wake of all this destruction to these institutions.
I think we're so often focused on what we're against rather than saying what we're for. Mm-hmm. And too often, those of us who have stood for science, we've had a really hard go of it because we've watched as corporations who we entrust to make things like vaccines and pharmaceuticals that people need and deserve, they have too often written the rules that regulate them. And that's meant that our healthcare is out of reach. I got to be honest with you, during COVID, we're asking people to take a vaccine for a disease that didn't exist a year ago, but then they can't afford insulin, which is medication for a disease they know they have. I think we have to recognize that the trust in public health has to also be trust in the healthcare system. And what that means is that we've got to make it easier to get healthcare in the first place. So I want to be going out there saying, hey, look, in a healthcare system where no matter what you do for a living, if you're working at all, you can go and get healthcare, even if you've been laid off of your job, and you don't have to worry about falling into medical debt. And by the way, when there's a new pandemic, here's a new medication we created that you can take to protect yourself. But when you feel locked out of the healthcare system, like too many people do, then when we come to you with a new medication that's for free for a disease that didn't exist a year ago, you're probably less likely to trust us. And so there's a reason as a public health official, I wrote the book on Medicare for All, because I know that if we're not serious about guaranteeing every single person in this country access to health care, then we're going to continue to lose the battle for hearts and minds when it comes to public health too.
It makes total sense. If you have a Medicare for all type of system, you're going to have more of the population have a relationship with the doctor. And they're going to have a much better perspective on this stuff.
And it's not going to be one where you're like worried about like pickpockets.
Exactly.
Taking $500 out of your next paycheck.
A for-profit medical system is turns out, in the case of like an extreme public health event, turns out to undermine people's confidence in public health. I hope he wins. Hey, folks, don't forget to hit the subscribe button and check out our daily show. We do it every day at 12 p.m. Eastern for about 2.5 hours. We even take phone calls. You should check that out.